Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Dementia with the Lewy bodies, we are looking at the revised criteria for the clinical diagnosis. So this becomes very essential for the diagnosis of the DLB. That is the dementia of the Lewy bodies, DLB. So this is defined as a progressive cognitive decline. So there is presence of progressive cognitive decline. So there is presence of progressive cognitive decline of sufficient magnitude sufficient magnitude to interfere with the normal social or occupational function, and it will interfere. So this will interfere. So it will interfere with the normal social occupational functions, or the normal social or the occupational. So it will involve the normal social or the occupational functions, or with the usual daily activities. Next is the prominent or the persistent memory impairment. So there is also presence of the prominent or the persistent memory impairment. Memory impairment, it may not necessarily occur in the early stages, but is very evident with the progression. So it is very evident along with the progression. Next is the deficiency of the test of attention. So there is also the deficits, presence of the deficit. So deficit on the test of the attention. So deficit of the test on attention, executive function. Then also the visio-perceptual ability, and it may be especially prominent and occur early. So this may be very prominent and occur early. Now let's look at some core clinical features. Now here in core clinical features. So here in clinical features, there are the fluctuating. So the first three typically occur early and may persist throughout the course. Okay. So starting with the fluctuating cognition. So there's fluctuating cognition. So fluctuating cognition with a pronounced variation in attention and the alertness. So there's varying alertness as well as the attention. Next will be the recurrent visual hallucination. So visual hallucinations, and this is going to be recurrent, and they are typically well formed and detailed. They are well formed as well as it is very detailed. Next is we look at the REM sleep. So when you look at REM sleep behavior disorder. So REM sleep behavior disorder, it may precede the cognitive decline. So it precedes cognitive decline. So it precedes the cognitive decline. Next, what do we have? Next is one or more spontaneous cardinal features. So you have one or more than one cardinal features of Parkinsonism. So there's cardinal features, and this is of the Parkinsonism. So they include the bradykinesia. So there is involvement of the bradykinesia. So bradykinesia, what does it mean? It means that there is a slowness of the movement and the decrement in the amplitude of the speed. So basically it shows the slowness. Next is there is rest. There is rest tremor as well as the rigidity. So there is rigidity. Now let's look at some supportive clinical features. So in terms of the supportive clinical features, so the supportive clinical features, CF, that is clinical features. So supportive clinical features, there is a severe sensitivity to the antipsychotic agents. So there is sensitivity, and this is to the antipsychotic agents. So the sensitivity to the antipsychotic agents, and there's postural instability. There is postural instability. Then there is repeated falls. There is presence of repeated falls. And the syncope or other transient episodes of unresponsiveness. There is syncope or there is a transient episode. Syncope or the transient episodes of unresponsiveness. Next is there is also the severe autonomic dysfunction. The severe autonomic dysfunction is also present. Now let's look at the examples. So when you look at examples, it includes a constipation. So it includes a constipation, then the orthostatic hypertension. Orthostatic hypotension. So there's constipation, orthostatic hypertension, then there is urinary incontinence. There's urinary incontinence. Then there is also the hypersomnia. There is hypersomnia as well as the hyposmia. Hyposmia. Then hallucination in other modalities. There is also hallucinations. There is also hallucination in other modalities as well as the systemized delusions. There is systemized delusions. Then there is presence of apathy. There is presence of anxiety, and there is also presence of the depression. Now let's look at the indicative for the biomarkers. So what are the indicative biomarkers? Indicative biomarkers, it includes a reduced dopamine transporter. So there is decrease in the dopamine transporter. So there's decrease in the dopamine transporter uptake. So decrease in the dopamine transporter uptake, and this is in the basal ganglia. This will be in the basal ganglia, and it is demonstrated by the SPECT or the PET. It is demonstrated by the SPECT or well as the PET. Next is there is the abnormal. There is presence of abnormal. So abnormal means the decreased uptake. So there is low uptake. So in terms of abnormal, there is 123 iodine. This is MIBG. 133 iodine MIBG. This is the myocardial scintigraphy. Next is the polysomnographic confirmation of the REM sleep. So there is a polysomnographic. So polysomnographic confirmation. And this is of the REM sleep. And this is without the atonia. So there is without atonia. Now let's look at some supportive biomarkers. So what are the supportive biomarkers? So in terms of supportive biomarkers, it includes the relative preservation of the medial temporal lobe. So there is relative preservation of the medial temporal lobe or the medial temporal lobe structures. So medial temporal lobe structures, and this involves the CT as well as the MRI scan. Next is generalized low uptake of the SPECT and the PET. So there is a generalized low uptake, and this is of the SPECT and the PET. So SPECT as well as the PET. Perfusion, PET perfusion, and metabolism scan, metabolism scan. And there is a reduced occipital activity. There will be a reduced, that is a decreased occipital. There will be a decreased occipital activity. And this will be with the plus or minus the cingulate island sign. Plus or minus the cingulate. So there is a cingulate island sign. And this will be on the FDG as well as the PET imaging. Then will be the prominent posterior slow wave activity. In terms of the prominent posterior, so prominent posterior slow wave activity. So this will be present in the EEG. So this is present in the EEG, and there is a periodic fluctuation in the pre-alpha and the theta range. So there is a periodic fluctuations in the pre-alpha. So pre-alpha as well as the theta range. Now let's look at the probable DLB if can be diagnosed if. So in terms it is a probable. In terms it is probable DLB, how can it be diagnosed? So here the diagnosis is by 2 or more. So 2 or more core clinical features of the DLB are present. So 2 or more core features of the DLB are present. So we saw, right, the fluctuating cognition, the recurrent visual hallucination, REM, sleep behavioral disorder, as well as the cardinal features of Parkinsonism. So it has here the greater than 2 core features and of DLB are present, and with or without the presence of the indicative biomarkers. So they can be present with or without. So it is with or without the presence of indicative biomarkers, without the presence of indicative BM, that is a biomarkers. Next it involves only one core clinical feature is present. So only one core clinical feature is present, but with one or more indicative biomarkers. So only one is present. This is the core features plus one or more indicative markers. Indicative markers are present. Now, other thing to note is the probable DLB should not be diagnosed on the basis of biomarkers alone. So biomarkers alone, it should never be diagnosed. Now, next is the possible DLB can be diagnosed. So probable DLB was the first one we saw. Now we are going to look at the possible DLB which can be diagnosed if. So only if one core clinical feature is present. So core CF is present. So one core CF is present and with no indicative biomarker reference. So there is no indicator. So there is presence of no indicative biomarker evidence. Next is what do we have? Next is one or more indicative biomarkers. So there is one or more. So one or more indicative biomarkers is present. So one or more indicative biomarkers is present, but there are no clinical features. So there is no CF, there is a clinical features are present. To learn and grow daily like this, please do subscribe.